Madam Speaker, the Affordable Care Act is working in Florida for a very simple reason. No one wants to be uninsured. People want affordable health insurance. Florida enrolled more people in health insurance coverage than any other state using healthcare.gov. This only illustrates just how high the demand there is for affordable coverage in our state. During the first open enrollment period, some 983,000 Floridians signed up. More than 90% were eligible for some type of financial assistance under the law, which drove premiums down to an average of $79 a month in Florida. In the span of a few months, our state uninsured rate dropped from 25% to under 20%. And I am confident that when open enrollment begins again this fall, even more Floridians will take advantage of the opportunity to get covered. Unfortunately, Madam Speaker, there are 1.06 million Floridians who won't have that opportunity. They don't make enough money to qualify for help buying private insurance in the marketplace, and they've been denied the Medicaid coverage that they're eligible for by Governor Rick Scott and by our GOP state legislature. Healthcare reform was designed to help more Americans afford private health insurance and provide basic coverage for low-income people through Medicaid. To do so, the law extended eligibility for Medicaid to people earning up to 138% of the federal poverty level. Talking in terms of the federal poverty level seems abstract, but for the millions of Americans working hard for such little income, the hardships that they face are very real. Earning 138% of the poverty level means barely making ends meet. For a full-time minimum wage worker, it means scraping by on less than $16,000 a year. For a family of four, it means bringing in less than $32,000 a year, struggling to afford food and other basic necessities. And unfortunately, in Florida, it also means going uninsured. That's unacceptable in 2014 when there's a federal law in the books that says that they don't have to be. And unfortunately, was a member of the House Medicaid Expansion Caucus here in Congress. Unfortunately, I find myself in a position where I have to ask Governor Scott and my former colleagues in the Florida legislature just a few questions. Are two young parents working fast food jobs in Miami less deserving of primary care visits than a couple working at the same burger chain in Colorado? Are the chronic headaches of a home cleaner in West Palm Beach somehow less serious than those doing the same work in West Virginia? Is a loved one struggling with substance abuse in Orlando any less worthy of treatment than someone in New York or in Maine? Are these 1,060,000 Floridians somehow undeserving of the coverage our federal health care law has made them eligible for? These are some of the most hardworking people in our state. They're proud moms and dads. They're cashiers and housekeepers, security guards, and fast food workers, office clerks and landscapers. They are veterans of Iraq and Afghanistan. They're adults who've gone back to college to further their careers. Our desire to give Florida families the same shot at leading a healthy, productive lives as Americans in any other state should be enough to convince Governor Rick Scott to call the legislature back into session tomorrow to get it done. But just in case our responsibility to protect families and promote public health isn't enough, economists have also found that no other state has more to lose by rejecting Medicaid expansion than Florida. Just this month, a McClatchy analysis of the Urban Institute data concluded that Florida's decision to deny Medicaid to 1,060,000 people will cost our state an astronomical $66.1 billion by 2022. Florida's hospitals are expected to lose $22.6 billion over that same period and will continue to bear the burden of providing expensive emergency room care to uninsured patients for nothing in return. The billions and billions of dollars at stake for Florida through Medicaid expansion would do far more than expand basic coverage to 1.06 million low-income people. These dollars would also generate new growth and opportunity throughout Florida's economy. That's because when hospitals are actually paid for their services, their balance sheets improve. They have more room to invest and to expand. When they build a new surgery wing, they put to work more engineers and construction contractors, and they hire new staff, and they create good, well-paying jobs in our state. According to the Council of Economic Advisors of the White House, the economic growth injected into Florida's economy would deliver about 63,000 new jobs between now and 2017. Missing out on that kind of opportunity would be devastating for our state. And failing to cover those 1,060,000 Floridians would not deliver real savings to taxpayers in the long run. It's time for Governor Scott and the Florida legislature to focus less on politics and more about helping Floridians, parents, students, veterans, and workers get the coverage they desire and that they're entitled to. I yield back.
The gentleman's time has expired. The chair recognizes the gentleman from Texas.